All right, in this lesson, we are going to be talking about wound care and bandaging, tourniquets, and wound packing. Okay, so we're going to talk about some of the anatomy here on page 51 of your textbook. So you want to flip on over there right now. Thank you. Just prop this up. I'm going to use here. Okay, there we go. So, quick anatomy lesson for you, okay? These soft tissue injuries are quite common. They're rarely life-threatening unless you hit, a major artery. But just a quick anatomy lesson here. The layers of your skin is nicely summarized in this diagram. The top layer of your skin is called your epidermis, okay? Underneath that is your dermis, which has all the hair follicles, sweat glands, okay? Capillaries. Fatty tissue is underneath that, and then on the very bottom is your muscle, okay? So wounds could either be external, you can see them, or internal. Can't really see them, can't really do much about them. So bleeding is also classified according to the blood vessel that is affected. So you have three different types of blood vessels. The smallest ones you have and the most abundant are called capillaries. They're in your peripheries. They allow for gas and oxygen exchange. The medium-sized blood vessels are called veins. You can sort of see them, feel them. They allow blood to go to your heart to receive the oxygen that it needs. And finally, the largest and the life-threatening bleeds are from arteries. Arteries are under a lot of pressure. They're coming straight from your heart, and they're full of oxygen-rich blood, so bright red blood, and it's pumping throughout your body so your body can receive the oxygen that it needs. If you were to injure an artery, and they're located where you have pulses, so here in your neck, your arms, big one in your groin, if you were to sever an artery, the blood would squirt, actually in sync to your heartbeat. Okay? And that's how you lose a lot of blood very, very quickly. Okay? So, on page 52 of your textbook, we're going to discuss the differences in the supplies that you might have in your first aid kit. So dressings versus bandages, first off. Okay? A dressing is a protective covering for a wound. It serves to absorb blood and control bleeding and prevent entry of bacteria into the body. So a dressing ideally is dry and clean, sterile if possible, but not completely necessary. You want it large enough to cover the wound. You want it to be made out of an absorbent material, so cotton's a great material, and lint-free so it doesn't stick into the wound. As you can imagine, that would be uncomfortable. A bandage, on the other hand, has several purposes. It secures the wound in place, or the splint in place. It also helps apply pressure to wounds, and it can help support an injured limb like a sling, which I will demonstrate shortly, okay? Bandages also immobilize body parts. Okay, so some rules when applying dressings and bandages. You're gonna position the body part as comfortably as possible. Do not remove, page 52, number 2, big bold words, do not remove bandages if they become soaked with blood. Add more on top. Avoid removing that first layer in particular because it is, of course, attached to the scab that's trying to form. Okay. We're going to assess for proper circulation by checking the color and temperature of the skin before and after bandaging. So if they feel any tingling or numbness, you can also check the pads of the hands. You can push down on the finger and it should go from a white back to the normal skin color, okay? So, a bunch of photos here on page 52 of different types of bandages and dressings that are very commonly found in first aid kits. Okay, so something that's sort of newish to the course are these hemostatic dressings. So there's a picture of that. They're these Z-folded dressings which can help promote clot formation. They're actually treated with a substance that helps aid in clot formation. So we're going to use these dressings, these hemostatic gauze dressings, when bleeding is not easily controlled. So for instance, you're bleeding quite profusely, and that area, for example here, you can't really apply a tourniquet on. You can use these hemostatic dressings. Torso would also be an area that you can use these hemostatic dressings on. Okay, we're going to pack the wound using 2 fingers, gloved hands of course, while continuously applying direct pressure. This helps slow down, maybe even stop the bleeding, and aid in clot formation. Okay, so you can use these dressings alongside a tourniquet, but they should not be used in place of a tourniquet when one is available and one can be applied. Okay, so on page 53, some rules with bleeding bandaging. Protect yourself, making sure you're wearing gloves. Try not to touch the wound. We're going to use clean bandages and dressings if possible. Wash your hands wash your hands after bandaging the person. Okay. Control bleeding. Bleeding is it can be life-threatening, so it needs to be controlled by using direct pressure, and if possible, prevent infections. We'll talk about that later in the course. Okay. If the person needs medical attention, do it as soon as possible. Okay, so we're going to have the casualty rest and relax. Make sure you ask for permission when you help people. Gloved hands, and we're going to use direct pressure to help reduce the blood flow and encourage clotting. Okay, checking for circulation above and below the injury site. So the temperature of the skin should be warm and equal on both sides. Okay. And then again, do not remove soaked dressings, blood-soaked dressings. Okay, add more on top, and tourniquets can be used to control bleeding. So first off, I'm going to show you a basic bandaging technique, okay, using 2 triangular bandages. So these are triangular bandages. When unfolded, they do form a triangle, so they're aptly named. I have a wound on my leg, okay? So right here, on my leg. So putting direct pressure on it with a dressing, okay? I'm going to take a second dressing, well, this is a bandage now, and I'm going to wrap it tightly around the wound, okay? So right now I can feel the lower extremity. I still have sensation, okay? There's no numbness or tingling. I'm pulling it fairly tight, right? You want these bandages to be fairly tight, almost slightly uncomfortable. When you tie a knot, you can tie it directly over the wound. Do make sure you tie a knot that you can untie without cutting the bandage off if needed to reduce some of the pressure if you lose circulation in the limb below. So I'm going to check for circulation, and yeah, I still have circulation. The bandage is fairly tight. I'm not able to slide it off. I'm barely able to put a finger between the bandage and the skin. So that's how you know it's tight enough. Okay, so we're going to have everyone try that. Okay, so a tourniquet. Where did I put that? Tourniquet. Okay. Sorry about that. Okay, so this is a commercial tourniquet. It's very user-friendly. It has this one piece, almost looks like a belt. We're going to apply it above the injury, 2 inches above, okay? So the injury is right here. I'm gonna tie it above, which means closer to the heart, 2 inches. So here is good, okay? If you find that 2 inches hits a joint, we never wanna tie tourniquets on a joint. We're gonna go above that by at least a centimeter there, okay? So I secure this, just simple as tightening it and Velcroing it, okay? Okay. So to apply the tourniquet, I'm going to take this little Velcro piece off, and I'm going to turn the tourniquet. Okay, so it's tight. Let's give it another half turn, and then tuck it in. Okay, there's a place for the time. The time is 10:19. I'm going to write that down with a pen. Okay, this does not get removed. EMS doctors, they take care of that. This stays in place, okay? So once a tourniquet's applied, it should not be removed, okay? And try not to cover it as well. We don't want the tourniquet to be hidden, okay? So let's take that off, take this off. Okay, so some emphasis points here. Yeah, so the general treatment for bleeding is push on it, direct pressure. Do not remove soaked bandages, add more on top, mentioned that a few times. Severe life-threatening external bleeding does lead to shock, so be on the lookout for shock, right? So make sure they're sitting down before you bandage them, keeping them warm, and talking to them firmly but calmly, okay? Again, in cases of severe bleeding, hemorrhage to a limb, when direct pressure alone is not adequate to control the bleeding, you might have to use a tourniquet. Or those hemostatic dressings can be used, again, alongside tourniquets. So, I want to show you the bandana bandage as well. So, let me do that on myself. If I have a wound on my head, okay, I'm gonna apply maybe indirect pressure around it, okay, especially if there's bone fragments that are, loose, or the bones are a little misshapen. I'm gonna put pressure around the injury opposed to directly into the bone fragments, okay. So let's say the injury is right here. The issue with injuries on the top of the head is that you need pressure, but wrapping the mouth shut isn't particularly safe. A person can't talk, and if they have to vomit, well, they can choke on that because it's where's it gonna go? Okay, so I have a bandage on my head, and normally I get a partner or a student to do this, but again, I'm alone. So bandage here, and I'm going to unfold my triangular so that the point, meaning the right angle, is going to be facing my neck. All right, let's see if I can do this. All right, so that's a setup. I'm going to take the hem of the bandage and I'm going to put it right at the eyebrow line. I'm going to pull it fairly tight, okay? If they had long hair, putting it up would be, or having them hold it would be a good idea so the hair doesn't get caught up. So when you cross it, I don't know if you can see this. Actually, you can't because I'm crossing it really low. You want to cross it very low opposed to high. If you cross it too high, like right here, it's just going to fall off like a hat. So I cross it low, and then I tie the knot in the eyebrows. Okay. Again, make sure you tie a knot that you can untie if necessary. So this is just going to be a simple double knot, but it's not super tight. Okay. So there is not too much pressure yet, but once I pull on this little flap down here, okay, holding onto the top here, you can see that, you can see that really well, but I am actually getting rid of all the excess slack in there, okay? So there we go. These ends are quite annoying, so you can tuck those in. And now I can actually feel there's quite a lot of pressure around the injury site. Okay, this part is tied tightly. All right, I'm ready to go to the hospital. All right, so some things to emphasize here. Yeah, again, you're tying the knot right around the eyebrow line, the hem is pulled tight, and you cross really low on the back. Okay. So let's say you are using a hemostatic dressing. So with my gloved hands, I'm going to ball up a portion of that hemostatic gauze in my hand. Okay, and then using my gloved fingers on both hands, I'm going to begin to push the gauze into the wound. Again, that gauze has that clot promoting material to help make scabs for them. So I'm going to kind of ball it up, push it in to the part of the body that is injured. Let's say it's my leg. I'm going to push it, to pack the wound. Okay, so once the wound is packed with hemostatic gauze, we're gonna use a bandage to, of course, secure it in place so that I don't have to continuously hold pressure myself. Okay, so we're gonna practice that as a group.